How's it guys, and welcome back. My name is James and this is That Med Guy. Today we're going to be discussing eclampsia and pre-eclampsia. We're going to be talking about what it is, how you're going to diagnose it, and how you're going to treat it, and why this is relevant to either someone who is pregnant or a person who's learning to treat pre-eclampsia. So pre-eclampsia is obviously what happens before eclampsia. Eclampsia is the part where a pregnant mother, generally in their second to third trimester, has a seizure due to a not so well understood mechanism. And the pre-eclampsia part is really when there's all these complications, generally got to do with the placenta's ability to transport nutrients and oxygen to the baby. What happens is that the mother starts getting blurred vision, headaches, they become hypertensive, and they get protein in the urine. Not that we can test for protein in the urine in the pre-hospital setting, unless you really wanted to, I guess. And the way we treat this pre-eclampsia is that we give them magnesium sulfate. We're not quite sure why magnesium sulfate works. It just happens to be one of those things, in the same way as that we're not quite sure how pre-eclampsia works. You kind of want to avoid the patient going into eclampsia, because that is obviously when the mother has a seizure. That's really bad, and in which case we're going to want to give them magnesium straight away. If the magnesium doesn't work for the seizure, we can then give a benzo like midazolam or lorazepam to stop the seizure. Obviously that's very important to stop. The way you're going to diagnose someone with pre-eclampsia is that you're going to see a patient who's in their second to third trimester, probably have swollen feet, they're going to probably have a headache, blurred vision, they're going to be hypertensive. I think their blood pressure is like above 130 is considered relative for pre-eclampsia. And these patients we can just start on a magnesium sulfate. Depending on where you live will depend on your dose and rate that you give that. Just remember that magnesium sulfate drops blood pressures because the way it works in the body is that it causes smooth muscle to relax. So obviously our veins are going to open up, so our blood pressure is going to drop. It's the same reason why we give it for someone who has asthma, because it causes bronchial dilation, because it makes the smooth muscles in the bronchi or the bronchioles dilate. That would be the reason why we give it for asthma. But for pre-eclampsia, we're not exactly sure how it works. It does lower the blood pressure, so just remember, don't give it too fast, because you can lower the blood pressure too much. We obviously don't want that. So guys, I know this was short and to the point. If you did like it, please hit like and subscribe. And remember, if you want to continue watching more, I post every week. Please tell your friends and colleagues about me, and I'll really appreciate that. And bye for now. Thanks for your time.